seat on the bed. My name's Mary, and I'm going to be your nurse today. Can you tell me your name and date of birth?
Erica Boggs and 12901.
Okay, when we were walking in, I was paying attention to your gait, just the way you walked, to make sure you weren't limping or you favored one foot over the other, and you had a normal gait, and I didn't notice anything at all. And looking at you, I can tell that your eyes are symmetric bilaterally, and your skin color is good. I don't see any abnormalities or anything that stands out, so everything looks really good. Now let me perform hand hygiene, and I'm going to need to touch you today to perform this assessment. Is that okay?
Yes.
Okay, let's get some gloves, and what we're going to start with is inspecting your hair, and what we're checking for is just any abnormalities, discoloration of the skin. We're going to just see what texture your hair is, and just make sure we don't have any pests. We don't expect to find any pests, but it's always nice to check. So when we're checking here, I can tell that your hair is brown. Is that natural curl?
Yes.
And it's a little bit dry. Not bad. Do you use conditioner?
Yes.
Okay. Let's go down around the bottom of the neck. I'm not seeing any pests. There's no discolorations. Everything's looking really good. Now let's check this side. Everything over here looks good. Okay, let's get rid of these gloves. And perform hand hygiene. That's for my safety and for yours. Next one I'm going to do is assess your arms. And I'm checking the temperature, which is warm. Then let's run my hands down. And that just checks. And you have a little dry skin on your elbows. But that just checks for any moisture on your skin, and I don't feel any, which is good. Now, if you'll pick your hands up, what we're going to do is just assess your nails. And looking at them, you're a nail biter?
Mm-hmm.
Everything, the consistency is good. The color is normal. And we're going to check capillary refill, which is about 1 second, which is good as long as it's under 2 seconds. 2 seconds is what's considered normal. Now, if you could take your hands and make a heart for me, just with those 2 fingers. Okay, that tells us that there's no clubbing, so that's good. Okay, and when I'm looking at your face, I can tell there's no visual edema. And what we're going to do, I'm going to check your skin tucker. Somebody's ticklish, which is good. Okay, next we're going to palpate your temporal arteries, and we do these at the same time. They're both +2, so we'd be +2 bilaterally. Next, we're going to do your carotid artery. We don't do these at the same time because it's not safe. We don't want to stop you from breathing or anything. Right side is +2. Left side is +2. Okay, next what we're going to do is assess your lymph nodes. And normally it's fine if we can't palpate them, which I can't. This is pre-auricular. I can't palpate them. Post-auricular, I'm not palpating anything. Cervical, I'm not palpating anything. It feels normal. Okay, let's move down around the back. This is clavicular. I'm not feeling anything there. Let's do tonsillar. Can't palpate those. Submandibular. I'm not palpating anything. Submental isn't palpable. Cervical chain. I can't palpate anything there. And supraclavicular. is not palpable, so everything's good there. Okay, next I'm going to note, if you can look straight ahead, we're going to note the position of the trachea, which is midline and intact. And then we're going to check matter strength. So what I'm going to do is if you can open against resistance. Okay, close. Open and close. Very good. Cranial nerve 8 is intact. Okay, so cranial nerve 5 is intact. So next what I want you to do is smile, frown, and puff your cheeks. Cranial nerve 7 is intact. Then what we're going to do is if you could get your water and take a drink for me. Very good. Cranial nerves 9 and 10 are intact. Okay, now we're going to palpate your thyroid. And for this, you'll need to take a drink of water. When I tell you to, take a drink of water, okay? Okay, if you can go ahead and take a drink. Upper left lobe of the thyroid is a little bit palpable. Okay, if you can go ahead and take a drink. The lower lobes are not palpable. Okay, now I'm going to move around in front of you and we're going to do the eye exam. Okay, next we're going to do a vision test. And I need to do hand hygiene before we do this. Okay, next, first thing we're going to do is I'm going to inspect your lids, conjunctiva and sclera. Okay, when we're looking at your lids, the hair is evenly distributed. There's no puffing, no swelling. Can you look down for me? Can you look up? Okay, now look down. Okay, so the sclera is nice and pink and the conjunctiva is white, which is what we want to see. Let's get our light here on our paper. Next, what we're going to do is I want you to hold this and I want you to cover one eye, put it straight out in front of you, and I'm going to watch your eye while you read what's on it.
EFDGB.
Okay, now let's switch to the other side.
EFDGB.
Very good. Vision is 20/20. Okay, so now just look straight at me. Just concentrate on my nose. Very good. Very good. Okay. Now, just stare at my light. Okay, very good. Now follow my light. Very good. Okay, now what I'm going to do is shine it from overhead, and I want it to hit right on the bridge of your nose. And what I'm looking at here is to make sure the light hits the same place in both eyes, and it does. So that's good. Okay, next what we're going to do is we did the corneal light, so that all the eye tests that we just did tells us the cranial nerves 2, 3, 4, and 6 are intact, which is good. So next we're going to move, and it also tells us your eyes are perla, which means the pupils are equal, round, reactive to light, and accommodation. So that means everything is good with your eyes. Next we're going to move on to your ears. And what I'm going to do for this is I'm going to cover this ear and I'm going to whisper 3 words and I want you to tell me what I say.
Cat, dog, rat.
Okay, let's do this one.
Dog. I don't know the second one. Pig.
Okay. So that tells us that cranial nerve 8 is intact, so that's good. Okay, next we're going to check your ears, and we're going to start by doing what's called a whisper test, and this is to check cranial nerve 8. So what I'm going to do is close this ear off, and I'm going to say 3 words, and I need you to repeat what I say.
Cat, dog, frog.
Okay, let's try the other ear.
Frog, dog, cat.
Very good. Cranial nerve 8 is intact. Okay, so next I'm going to inspect your outer ear, your external ear. What we're looking for here is any calcifications, any masses, or just anything that's abnormal. And looking at it, I can tell that everything feels good and it looks normal. So then we're going to move to this ear. back. I don't feel any calcifications, any abnormalities. The ear's nice and pink. Everything looks really good. So, some hand hygiene. The next thing we're going to do is inspect the inside of your ear, and we're going to check the tympanic membrane. So the way we do this is we pull the ear up and back. Let's turn our light on. Okay. Okay, I can see that your tympanic membrane is pearly gray and shiny, and the skin surrounding it is just pink. It's not swollen or irritated. There's a little bit of earwax, and I do see some hair present, but we would expect to be normal, so everything looks good in that ear. Now we're going to switch over and do the other ear. And again, we pull up and back. And when we look in this ear, we can see the tympanic membrane in this ear, and it's also pearly gray and shiny, and the skin around it is pink. It's just a dull pink. It's not swollen or irritated. Again, there's a little bit of wax, a little bit of hair present, but really everything looks good. Okay? So let's clean that with an alcohol wipe. Okay, next what we're going to do is move on to your nose. And what I want you to do is cover one side, but I want you to close your eyes for this, because while you're breathing in, I'm going to pass a smell under your nose, and I want you to tell me what you smell. Breathe in and out. Deep breath. Okay. What did you smell? Let's try again. That's okay. Let's try again. Okay, ready? What was the smell?
An orange.
Okay. Now let's try the other side.
A lemon.
That's a little stronger smell, isn't it? That smells not is unmistakable. Okay, so that test tells us cranial nerve 1 is intact. So next, what we're going to do is, somebody got my eye. What we're going to do is we're going to have you look up, and we're going to inspect the inside of your nose. And what we're looking here is checking the turbinates, the membranes, and the septum. And it is a little red in there. It's not swollen. The septum looks good. Let's check this side. Again, this side looks good. It is a little red. Have you had a cough or anything?
No.
Okay. Well, that looks good. Okay, next what we're going to do is check your frontal sinuses, which are here. Is there any pressure?
No.
Okay. Then we're going to check your maxillary. Do you have any pressure there?
No.
And let's go ahead and check your ethmoid. Is there any pressure there?
No.
Okay. So that's good. Okay, next what we're going to do is we're going to do hand hygiene. And the next thing, I'm going to put on some gloves, and we are going to check your mouth. We're just going to check everything in there to make sure everything feels all right. My gloves don't like me today. We're going to start with your lips. So let's look at your lips. Okay, I can look at them and tell that they're nice and pink. I don't notice they're not cracked. They look normal. My gloves do not like me. Okay, so what I'm going to have you do is look up at me, and I want you to open your mouth. And I'm going to look around. I'm checking your mucosa, your gums. Let me see if I feel anything. I do know that you are wearing braces, which are catching on my gloves, so we're going to be careful in there. Okay, everything looks good there. Okay, let's check the top of the mouth. Are you wearing a bite plate?
Mm-hmm.
Okay, let's go and take that out. That would have been funny to note that you had a purple palate. Okay. All right. The palate feels good. Let's check down in here. There's no knots, no lesions, no abnormalities. All your teeth look good. I don't know any cavities. Can you look up so I can see your upper teeth? Okay, so you do have a couple space maintainers. Okay, now if you could stick your tongue out for me. For this, I'm going to have to hold your tongue. And I'm just checking for any lesions or lumps or bumps or anything. And I'm not feeling anything. I don't see anything. Okay, now I'm going to stick my finger on your tongue. And I want you to open as far as you can and say, ah. I'm going to watch your uvula. Okay. Now let me get my light, and I'm going to shine my light in there because I want to check your tonsils too. Okay, if you can look up. Now stick your tongue way out. Say, ah. Tonsils are present, grade 0. Uvula is good. So by doing that, that tells us that cranial nerves 9 and 10 are intact. And can you say light, tight, dynamite?
Light, tight, dynamite.
Awesome. That tells us cranial nerve 12 is intact. Okay, next I'm going to take off my gloves and perform hand hygiene. Okay, next we're going to inspect the pericardial area. For this, I'm just going to pull your shirt down a little bit, and I'm not seeing any. There's a tiny mole there, but other than that, I'm not seeing any abnormalities. The skin has a good color. Everything looks good, so everything good is good there. I'm going to move around behind you. Okay, next I'm going to slide in behind you. And what we're going to do, first thing I'm going to do is clean my stethoscope good with an alcohol wipe. Okay, I'm going to inspect your posterior chest, which is your upper back. And looking, the only thing I'm noting is that there's a tattoo on the upper right, and there is a small mole there. There's no, I don't see anything at all. The skin is nice. Hey, you been laying in tanning bed?
Yeah.
You can tell. Okay. So next one I'm going to do is assess your lungs. And each place that I place the stethoscope on your back, I want you to take a deep breath in and out, okay? All right. We're going to start in the upper left lobe. Very good. Upper right lobe. Good. Okay, we'll do the lower left lobe. Lower right lobe. Okay, one spot left, okay. Very good. The next thing I'm going to do is check for symmetric expansion, and the way I do this is I'm going to put my thumbs on your back, and I want you to breathe in and out. Okay. Do it again, please. Okay. Both sides are equal bilaterally, so that's good. And when I was listening to your lungs, I didn't notice everything sounded normal. There wasn't any crackles or wheezes or anything, so everything was good. Okay, let me clean my stethoscope with an alcohol wipe and perform hand hygiene. And the next thing we're going to do is assess your heart. And we're going to start with the aortic valve. So let me get these in. Okay. Okay, it's strong, +2. Very strong, +2. Okay, let's move over here for the tricuspid. Very strong. Okay. Let's get to mitral. Wow, very strong, +2. Next thing we're going to try to do is get you to lean over to your left. And I'm going to try to see if I can feel the mitral. We're going to listen to see if we can hear the point of maximal impulse. Okay. Okay, next what we're going to do, I'm going to wipe that off with an alcohol wipe, is we're going to assess your upper and lower extremities for edema. The way we do this is we pinch here, very good. There's no dehydration or anything, no edema. Okay. That's good. And then down here, what we do is we press, and it just bounces right back. The color comes back, so that's good. Okay. Okay, so when we compare the upper and lower extremities bilaterally, there is no edema present. Okay, the next thing we're going to do is assess the pulse in your lower extremities. And what we're going to do, I'm going to lift this leg up, and we're going to start behind your knee with the popliteal pulse. I can feel it in that leg, in that one, okay. So let's do this one. Can't, yeah, oh, wait. Yeah, I can feel it in that one, okay. Next, we're gonna check the posterior tibial, which is inside here. And the dorsalis pedis, which is on top of the foot. Barely palpable, but I can tell just by looking at your legs that where there's hair growing on your great toe, that tells us that you're getting good blood flow down. Okay, let's switch around and check these. Okay, let's check on the inside. I can palpate that one. And the same one is foot. When we're looking at your great toe, we can see that there's a little bit of hair growing. There's hair growing on the top of the foot. So that tells us, and the skin is warm, so that tells us you're getting adequate blood flow to your lower extremities. So that's good. Okay, if we can get you to lay down, the next thing we're going to do is lay your head down here, is we're going to assess your abdomen. And for this, I'm just going to pull your shirt up a little bit. And when we're looking at the abdomen, we can tell that the color's good. There's no lesions. There's a little bit of hair right there. And you do have a belly piercing?
Used to.
Used to, you bet. Yeah, it looks like it's grown up. Okay, let me clean my stethoscope. Because what I'm going to do first, to get some hand hygiene, is auscultate bowel sounds. And we're going to start on the upper right. Okay. Upper left. Lower left. Lower right. Your lower right and lower left is very active this evening. What'd you have for dinner?
Chicken sandwich.
Okay, next, what we're gonna do. Okay. Hear that sound? Okay. Upper left. Let's move to the lower. Hear how the sound changes when you get to the lower? Let's do lower right. Okay, next what I'm gonna do is I'm gonna palpate for the liver. You are a solid mass of muscle, and I don't think I'm going to be able to palpate it. So we're going to note that the liver is non-palpable. Okay, now if you want to set up for us, everything's good in the abdomen, if somebody's really ticklish. Okay, so I want you to swing your legs around that way. And when we were checking the abdomen, was there any place that was tender?
No.
Okay. Alright, let's do the spine. Okay. Let me know if there's any place. I'm not feeling any nodules or any abnormalities. Now, if you could lay back down for me, because there's one thing we forgot to do on the abdomen. We auscultated, but we didn't palpate. So the next thing I'm going to do, I'm going to start on the upper left, and I want you to tell me if there's any place that is tender. Upper right. Let's go lower left. Lower right. Okay, I can see that somebody is extremely ticklish. Okay, the next thing I'm going to do, if you'll hold your arms out, is I'm going to compare them bilaterally. And looking at them, I can tell that the hair is evenly distributed on both arms. There's no lesions. I don't see any abnormalities. The color is consistent on both arms. I did note earlier, you do have a little bit of dry skin right here, and it looks like something has scratched you right there. So when we're comparing them bilaterally, we can tell on the left side we do have a little bit of dry skin and just a little scratch. Now, if you don't care to uncross your legs, and let's look at your legs, and we're going to compare them. And we can tell that the legs are shaved, but the hair, you can tell, is evenly distributed. You have a little bit of a scar
I accidentally stabbed myself.
on the right side, and then is this a birthmark? Yep, right here on your knee, just a little dark spot. Okay, the skin is dry, there's no moisture, arms or legs. So when we're comparing them bilaterally, we can tell there's no moisture, hair is evenly distributed, everything looks normal. Okay, the next thing we're going to do is assess the range of motion in your upper extremities. This is the fun part. Can you shrug your shoulders? Can you do the scarecrow? Okay. Can you turn your arms up? Can you rotate your palms? Okay. Now for your lower legs, can you uncross them? Can you lift this leg up, straight down? Can you do the same with this leg? Okay. Now put this leg up. Can you push the gas pedal? Good. Can you raise it all the way up? Then push it all the way down. Okay, put this leg down. Okay, raise this leg up. Do the gas pedal. Good. All the way up, all the way down. Very good. Oh, excuse me for just 1 second. Okay, next thing we're going to do, if you'll put your hands up, and I want you to squeeze my fingers. Good. The patient has good hand grips. Go ahead and do it again. All right. Put your both feet up. If you will push against my hands. Oh, yes. Foot strength is equal bilaterally. Hand strength is equal bilaterally. Now, the next thing we're going to do is I'm going to assess different parts of your arms and legs for soft and dull. When you feel that, that is sharp. When you feel that, that is dull. And I just want you to tell me when I touch you if you feel sharp or dull. But I want you to shut your eyes while I do it, okay?
Soft. Sharp. Soft. Sharp. Soft. Soft.
Very good. Now what I need you to do is to take this hand and touch your finger to your nose. Very good. Now do the same thing with the other. Very good. Now if you can bring this leg up, I want the back of this ankle on this shin. Good. Now switch and do the other. Very good. Now I'm going to ask you 3 questions and I want to see if you can answer them for me, okay? Do you know what year it is?
2019.
Do you know what color an orange is?
Orange.
What's your mom's name?
Mary.
Very good. Okay, the final thing we have to do today is our vital signs. So what we're going to do first is we're going to put this on your finger and get your oxygen level. Okay, it's 98%. That's good. Next thing we're going to do is take your temperature. If you will put this under, put a sleeve on it. Put this under your tongue. You'll hold that until it beeps.
There's so much we want to show her.
98.2. Very good. Okay, let's clean that off. Okay, now the next thing I'm going to do is check your radial pulse.
Explore the heart of historic Europe with Viking. You'll get closer to iconic landmarks, to local life and legendary treasures. As you sail on board our patented award-winning Viking longships, you'll enjoy many extras, including Wi-Fi, cultural enrichment from ship to shore, and engaging excursions. Viking, voted #1 river cruise line by Condé Nast Bridges. Learn more at vikingrivercruises.com. Tell me a story in any language you want.
Okay, pulse is 76. Respirations are 20. That's good. Let me clean my stethoscope. The next thing we're going to do is find your radial pulse. Okay, radial pulse is obtained. Okay, let's get the blood pressure cuff. You got little tiny arms. Let's see. You hold this arm up. Alright, next we're gonna find the systolic threshold. We do this by finding your radial pulse. Okay. Okay. Systolic threshold is 110. Okay. No, systolic threshold is 130. I'm sorry. Okay. Now let's check your blood pressure. Blood pressure is 110/70. Alright, let's perform hand hygiene. Now, are you experiencing any pain at all today?
No.
Any discomfort?
No.
Okay, I will document all of your findings and I will let your doctor know and somebody will be in to see you shortly.
Thank you.
And thank you for letting me be your nurse today.